Welcome back to CTV Morning Live, our Ask the Expert segment. Sean Lennox is joining us from the Advanced Hearing Group. And we've got questions coming in, 789-6559, extension 2803 if you want to call us live on the air. Ottawa.morning@ctv.ca is our email. You can also leave us a message or a question on our website, on our Facebook page, CTV Ottawa Morning Live. So we're going to get to a question in just a second, but I made reference to this a little bit earlier, and I wanted to talk about the advancements. And This is pretty much something you can't tell anymore when people have a hearing aid.
Yeah, we were the first ones in Ontario, I believe, to get this Lyric product, which is the one that we're holding right there. It's a long-term device, so you actually implant it or insert it in the ear canal. The audiologist does, of course, with a whole bunch of candidacy screening and things like that, and it's worn there for 3 months straight, and the battery dies, we get it, take the old one out, put a new one in, and so it's an office visit every 3 or 4 months, but that's fairly standard. The Lyric, it's a great product. It's one that we've done very well with, and we were obviously trusted to be one of the first in Canada to have it.
It must be really interesting, especially for people who might have been conscious about wearing something on the exterior, that this was the perfect answer for them.
Oh, for sure. If it does work out for them, it is a godsend. They love it, and we're just so pleased with it. And we have these other devices too that are sort of mimic the depth of the Lyric, but you can actually remove them and clean them each night. They're a lot less expensive as well, but these are all the invisible in the canal strategies that are very popular and taking off. They're not for everyone, of course, but we counsel people on when they're a choice or when they're not a choice.
When they're a good candidate for this, because not everyone is going to be, well, they would love to have something like this.
They would love it, yeah. It's not for them.
It's not for everyone. We do have a question, and I believe we're heading to the phone lines. Good morning.
Good morning.
Good morning. Hi, okay, what's your question?
My question is, my mom is actually going on 99 years old. She has a hearing aid, but right now it's not working the best. She hears actually better with it out than what she hears with it in. Just wonder if that's normal or...
How long has she been wearing her hearing aid for? How long has she been a hearing aid user, would you say?
Oh, I'd say about 10 years.
About 10 years. Okay, great. Well, in that case, you know, if she's hearing just as well without it as she is with it, there's definitely a problem with the hearing aid. That's just point blank. You know, if she can't hear as better with the hearing aid in a quiet room, one-to-one, she feels like she can't hear soft speech any better with the hearing aid's malfunctioning or is not functioning up to par. So she should visit her audiologist and get them to actually check the programming, do a listening check and make sure it's actually doing what it's supposed to. And most likely the hearing aid isn't functioning properly, and you'll get your answers by visiting an office, either where you go or you can come visit us on Metcalfe Street.
It's pretty impressive, 99 though. You know, and you know, it just started to see issues 10 years ago, and
yeah, we see a lot of the older generation coming in to see us. You know, 85 plus, and it's a great population to work with. They're just so thankful when things do work, but they really know when things aren't working. So if the hearing aid's not giving her any benefit, that's something definitely to either just bring it into the audiologist yourself or get her to go in with you.
Is there a different treatment? Is there anything different, you know, when you look at skin surface or with an older individual than you would with someone who's in their 30s, 40s, that
yes,
a little bit more sensitive?
Yeah, well, definitely. In terms of wax buildup, to be completely honest, it's a big issue. We usually do debridements or wax removals every 2 months, but also you have to think about dexterity issues. You have to think about fit. These individuals don't have as easy of a time actually getting in their ear, so you have to worry about actually being able to sense that they have to maneuver them. Yeah, so yeah, there's lots of considerations, and we take each case one by one, and you know, not everyone's. You can't assume one 99-year-old's like the next 99-year-old. So.
Okay, you mentioned the wax buildup. How often do people not take into consideration that is a factor, or that could be what is irritating them?
Oh, it's all the time. They usually come in thinking they're hearing impaired, they've lost their hearing, but really there's just occluding wax. Also with hearing aids as well, the hearing aid's not working, it's not functioning, what's going on. It's usually wax, and that's why we do debridements. We make sure the ear canal is perfectly clear, and then that fixes most of the issues, if not all.
Would the general population be dealing with this as well, or what would you recommend to just stay on top of it?
Not real. I wouldn't worry about it too much. No. It's not like an epidemic or anything. Earwax is perfectly normal. It has antibiotic properties. It's going to keep the ear canal nice and healthy. So no, don't get the earwax removed unless it's totally occluding the ear, or unless you're really concerned about it causing hearing problems.
Which in some cases it has, but that usually there's other issues that are involved with that.
Yeah, for sure.
Well, because I ran into it, I was just mentioning it to you, and how with children and the Q-tips. My daughter Andy was using it, and then all of a sudden we were chatting, and then she took it out, and then I realized there was no longer any cotton, that she had left it in her ear.
That'd be scary.
Is this something that is common, or you just have to pretty much stay on top of it? Like I went searching with tweezers.
Well, you fixed the problem, but you would rather it didn't happen.
But had I not been there and actually
known.
seen her, I would not have known, because I don't think she would have told me that she had done that and it had stayed. So what, like...
It happens a lot. That's why we don't get kids to use, or anyone to use Q-tips so they can actually get stuck into the ear. Just the outside of the ear, of the ear, and then you're okay. But if the Q-tip goes into the ear canal and it can actually get lodged, it's going in too deep. Let's put it that way.
Has that been an issue? Like, do people sometimes come in like months later and say something's wrong, and then...
It happens all the time.
Okay.
It's actually quite funny. We usually just say, "Oh, look, you have a cotton swab ball in your ear," and they're like, "Oh,
that's where I
don't remember where they are."
Yeah.
Weird. And then when you take it out, they're like, "Whoa, give me my hearing back. That's sweet." Yeah. And then they're happy. But yeah, it's definitely happens for sure.
It happens. We touched on the lyrics. We had other devices here too. Are these new, or are they?
These are relatively new. We try to stay we are on the cusp of the technology. So every single invisible in the canal device that you see marketed, we dispense, just because we try our best to make sure we're ahead of the game. This is the Otolens, and this is the Sonic Groove. Basically, though, if you're going to go for these IIC devices, the lyric is the way to go. And if you can't wear the lyric, then you look at these other options for sure.
What would be the factors that you wouldn't be able to use?
Ear canal geography, or the anatomy. So you're looking at actually too narrow ears. Ear canals are too short. We do a full screening, so we actually do a measurement, and we make sure the ear canals are long enough and have the right circumference. So that's a big issue. Sensitivity, psoriasis, eczema in the ear canal, these are all things that could cause you to be not a candidate.
What about age?
Age is a big issue as well.
Like, would you do this with a young person?
Yes, most of the time it's within the 40 to 65 age range. Past that, then we have people who are immunosuppressed for diabetes, other issues like they're on blood thinners and things like that. You wouldn't want the lyric in those situations.
So this is something that is seriously discussed and gone through all the factors.
Yes, we don't rush people into it.
We're going to have more from the Advanced Hearing Group. Sean's going to be here to answer your questions. That's how you can get a hold of us. 789-6559, extension 2803. Send us an email, ottawa.morning@ctv.ca, or find us on Facebook, CTV Ottawa Morning Live. We'll back after this commercial break.